Hey guys, for my inhaler presentation, I had the inhaler QVAR. QVAR is used to prevent and control symptoms of asthma. Some symptoms of asthma may include shortness of breath or wheezing. It can also reduce swelling and inflammation of your airways. I actually have a client at my work who uses QVAR. I think he uses it 2 to 3 times a day, and he's been using it for about 2 years, and I talked to him about it, and he said it's one of his best medications that he takes. It's the one he can see the most differences in his other medications, meaning that it helps him. He thinks it helps him the most out of a lot of his medications that he takes. He used to have asthma pretty bad, and he rarely has flare-ups of his asthma, and he believes it's due to the QVAR, which he absolutely loves, which is kind of cool. So it's kind of cool to talk to him a little bit and really get to know from someone with firsthand experience of taking this medication. I think that helped me out a lot on this. Though QVAR can help, it helps reduce asthma. It cannot help you when you're having an asthma attack. When you're in the middle of an asthma attack, it's not like you can grab your QVAR inhaler and the asthma attack will be cured. It's kind of one of those things that just start to cure your symptoms over a period of time. So that's that. Let's see here. The generic name of QVAR is beclomethasone. It's in the drug class of corticosteroids, and it's a meter dose inhaler, which means there's a meter on it with a green and a red zone. Once it gets in the red zone, that is when you should get a new inhaler. And every time you take a dose of QVAR, the meter will go down. So that's kind of a cool little thing about it. How is it used? It's best used if you prime it a couple times, and also shaking it 3 to 4 times can help before you use it. You want to hold it upright to your mouth, with the mouthpiece towards your mouth, obviously. And when you take the cover off, you want to look for any foreign materials that could be on there. There's 2 methods that can be used when taking QVAR. One is the open mouth method, which is when you hold it up to your mouth or your face, and you open up your mouth. It's 1 to 2 inches, I believe, and you spray it into your mouth. That's kind of a weird method to me, I think. I've never seen someone take it like that, but that's a method. The closed mouth method is when it's a more common one, I would assume. You just wrap it around your mouth and inhale it. So those are the 2 methods you can use. And once you take this medication, you inhale, and it's very important to hold your breath for up to 10 seconds, it said. This gives the medicine time to travel down your airways and get into your lungs. And giving it that time to get down there is one of the most important things I came across. Most people just inhale it and don't hold the breath, and the medicine doesn't have time to get down to their lower airways and into their lungs. So that was a big thing that I came across. So that's that. So cleaning of the QVAR, you take off the canister of it, obviously. You can wash the mouthpiece, the cap, and then a spacer if you're using one. It's best to be cleaned with warm soapy water, and then rinse it off with warm water and let it completely dry. And let everything completely dry before you use it next. Some clinical teaching moments. The important things about the QVAR to know and remember. The biggest thing that I came across was the holding your breath for 10 seconds and letting the medicine totally get down to your lower airways and into your lungs. That was one of the biggest things and probably one of the most important things. It's a meter dose inhaler, like I said. Some side effects can occur when using this. I mean, it's a steroid medication, which steroids sound scary, but some steroids are good, like this one. You can get respiratory infections. Some people reported headaches. Another one was throat inflammation can occur. Steroid, it's a strong drug, so I mean, like I said, respiratory infections can occur, so some things to consider if you're thinking about taking QVAR. And let's see. I think that is all I got for you guys. So thanks for listening, and I hope you guys learned something. And it is also super awkward to record yourself, but it's what we're doing. So see you guys later.